Welcome back. In today's NCLEX Mastery session, we're tackling one of the most commonly tested and most frequently missed topics on the exam: delegation rules for the RN, LPN, and UAP. Many NCLEX questions don't just test what you know. They test who should perform the task. Understanding each team member's scope of practice is essential for answering prioritization and delegation questions correctly. You'll work through 50 challenging, real-world clinical scenarios designed to sharpen your decision-making skills and help you confidently identify which responsibilities belong to the RN, which can be delegated to the LPN, and which are appropriate for the UAP. Let's begin and see how many you can answer correctly. Question 1. A registered nurse, RN, begins the day shift on a busy 32-bed medical surgical unit. The assigned team includes one licensed practical/vocational nurse, LPN/LVN, and one unlicensed assistive personnel, UAP. The RN has responsibility for 4 clients. A 58-year-old admitted 2 hours ago with diabetic ketoacidosis, receiving an insulin infusion requiring hourly glucose monitoring. A 76-year-old recovering from pneumonia, whose oxygen saturation has remained stable on 2 liters per minute via nasal cannula, and who is scheduled for routine oral medications. A 45-year-old postoperative client 24 hours after a laparoscopic cholecystectomy, who requests assistance with bathing and ambulation. A 70-year-old with chronic heart failure awaiting discharge teaching about newly prescribed furosemide and daily weight monitoring. Which nursing action demonstrates the most appropriate delegation? A. Assign the LPN to complete discharge teaching while the UAP monitors the insulin infusion. B. Assign the UAP to assist the postoperative client with bathing and ambulation while the RN performs discharge teaching and manages the client receiving the insulin infusion. C. Assign the LPN to perform the initial assessment of the client with diabetic ketoacidosis while the RN administers oral medications. D. Assign the UAP to administer routine oral medications to the pneumonia client while the LPN completes the postoperative assessment. Answer: B. Assign the UAP to assist the postoperative client with bathing and ambulation while the RN performs discharge teaching and manages the client receiving the insulin infusion. Rationale: stable clients requiring assistance with activities of daily living, ADLs, may be delegated to the UAP. Initial assessments, insulin infusions, clinical judgment, and patient education remain RN responsibilities. Question 2. An RN is supervising an LPN and a UAP in a rehabilitation unit. One client experienced a cerebrovascular accident, stroke, 3 days ago and has mild dysphagia, but stable vital signs. Another client has newly diagnosed atrial fibrillation and is awaiting initiation of intravenous heparin therapy. A third client is recovering from total hip replacement and requires assistance transferring from bed to chair. Which task should the RN delegate to the LPN? A. Perform the initial neurological assessment on the stroke client. B. Initiate intravenous heparin therapy after reviewing laboratory results. C. Reinforce previously taught swallowing precautions with the stroke client. D. Interpret telemetry changes and notify the provider. Answer: C. Reinforce previously taught swallowing precautions with the stroke client. Rationale: LPNs may reinforce teaching that the RN has already initiated and care for stable clients. Initial assessments for heparin initiation in many NCLEX scenarios and telemetry interpretation require RN judgment. Question 3. The RN is caring for 4 clients during a morning shift. Which task is most appropriate to delegate to the UAP? A. Evaluate pain relief 30 minutes after 4 morphine administration. B. Obtain orthostatic blood pressures on a stable client with hypertension. C. Assess a newly admitted client's skin integrity. D. Teach a client how to use an incentive spirometer. Answer: B. Obtain orthostatic blood pressures on a stable client with hypertension. Rationale: UAPs may collect routine, predictable data such as vital signs. Assessment, evaluation, and teaching require RN judgment. Question 4. An RN delegates a routine blood glucose check before breakfast to a UAP. The UAP reports a glucose level of 48 milligrams per deciliter and states the client is sweating and confused. What should the RN do first? A. Ask the UAP to repeat the glucose measurement in 1 hour. B. Personally assess the client and initiate treatment according to the hypoglycemia protocol. C. Tell the LPN to document the finding. D. Continue medication administration before reassessing the client. Answer. B. Personally assess the client and initiate treatment according to the hypoglycemia protocol. Rationale. Although obtaining the glucose was appropriately delegated, interpreting an abnormal result and initiating intervention are RN responsibilities. Question 5. The RN is assigning tasks on a surgical floor. Which client is most appropriate for the LPN? A. A client admitted 20 minutes ago with suspected pulmonary embolism. B. A stable client receiving routine wound care after abdominal surgery. C. A client requiring comprehensive discharge teaching after a new colostomy. D. A client experiencing sudden chest pain and hypotension. Answer. B. A stable client receiving routine wound care after abdominal surgery. Rationale. LPNs commonly provide care for stable clients, including routine wound care. Unstable clients, admissions, and extensive teaching remain RN responsibilities. Question 6. An RN delegates feeding assistance to a UAP for a client recovering from a stroke. During the meal, the UAP reports that the client begins coughing repeatedly while swallowing. What is the RN's priority action? A. Instruct the UAP to continue feeding slowly. B. Assess the client immediately for aspiration and stop oral intake. C. Tell the LPN to complete the meal. D. Document the event after lunch. Answer. B. Assess the client immediately for aspiration and stop oral intake. Rationale. Feeding assistance may be delegated, but recognition and management of complications require immediate RN assessment. Question 7. An RN is supervising an experienced UAP. Which assignment requires RN intervention before delegation? A. Ambulate a stable postoperative client. B. Record intake and output. C. Measure routine vital signs on a stable client. D. Obtain vital signs every 15 minutes for a client who returned from surgery 30 minutes ago. Answer. D. Obtain vital signs every 15 minutes for a client who returned from surgery 30 minutes ago. Rationale. Frequent postoperative monitoring involves ongoing assessment of an at-risk client. The RN should perform these assessments and interpret findings. Question 8. The RN is caring for a client receiving blood transfusion therapy. Which task may safely be delegated to the LPN? A. Perform the pre-transfusion assessment and verify blood with another RN. B. Monitor the stable client after the RN has initiated the transfusion, according to facility policy. C. Obtain informed consent. D. Evaluate for a transfusion reaction and determine whether the transfusion should continue. Answer. B. Monitor the stable client after the RN has initiated the transfusion, according to facility policy. Rationale. In many NCLEX scenarios, the RN initiates blood transfusions and performs the initial assessment. Depending on policy, the LPN may monitor a stable client afterward. Consent and evaluation require the RN. Question 9. The RN receives the following requests simultaneously. Which task should be delegated to the UAP? A. Explain insulin self-injection to a newly diagnosed diabetic client. B. Collect a clean catch urine specimen from a stable client. C. Assess a client reporting new onset shortness of breath. D. Evaluate effectiveness of a PRN pain medication. Answer. B. Collect a clean catch urine specimen from a stable client. Rationale. UAPs may perform specimen collection after instruction. Assessment, evaluation, and patient education are RN responsibilities. Question 10. An RN observes an LPN asking a UAP to administer a scheduled oral antihypertensive medication because the unit is busy. What is the RN's best action? A. Allow the UAP to administer the medication because it is routine. B. Instruct the LPN to administer the medication because medication administration cannot be delegated to the UAP. C. Permit the UAP if the client has taken the medication before. D. Ask another UAP to witness medication administration. Answer. B. Instruct the LPN to administer the medication because medication administration cannot be delegated to the UAP. Rationale. UAPs do not administer medications in standard NCLEX delegation scenarios. The RN remains accountable for ensuring delegation is appropriate and within scope. Question 11. An RN is supervising an LPN and a UAP on a telemetry unit. The RN has admitted a new client with unstable angina, is monitoring another client receiving a titratable nitroglycerin infusion, and is caring for 2 stable clients preparing for discharge later in the day. One stable client has a healing stage 2 pressure injury requiring a routine dressing change that has remained unchanged for several days. Which assignment is most appropriate? A. Delegate the routine dressing change to the LPN while the RN manages the unstable clients. B. Delegate the dressing change to the UAP because the wound is stable. C. Ask the LPN to independently titrate the nitroglycerin infusion. D. Ask the UAP to complete the discharge teaching for the stable client. Answer. A. Delegate the routine dressing change to the LPN while the RN manages the unstable clients. Rationale. LPNs may perform routine treatments such as dressing changes for stable clients. Titrating vasoactive infusions and discharge teaching require RN assessment and clinical judgment. UAPs cannot perform sterile wound care or patient education. Question 12. An RN delegates routine morning vital signs to a UAP. The UAP reports that a client who underwent bowel resection yesterday has a blood pressure of 84/50 millimeter of mercury, pulse of 128 beats/min, and appears pale and diaphoretic. What is the RN's priority action? A. Ask the UAP to repeat the vital signs in 30 minutes. B. Personally assess the client immediately and initiate appropriate interventions. C. Tell the LPN to document the findings. D. Continue scheduled medication administration before evaluating the client. Answer. B. Personally assess the client immediately and initiate appropriate interventions. Rationale. Data collection may be delegated, but interpretation of abnormal findings and intervention remain the RN's responsibility. These findings suggest possible postoperative hemorrhage or shock. Question 13. An RN is assigning clients to an experienced LPN. Which client is most appropriate for the LPN? A. A client admitted with acute pulmonary edema requiring rapid assessment. B. A client returning from the PACU 20 minutes ago after colon surgery. C. A stable client with cellulitis receiving scheduled 4 antibiotics and routine assessments by the RN. D. A client with chest pain awaiting emergency cardiac catheterization. Answer. C. A stable client with cellulitis receiving scheduled 4 antibiotics and routine assessments by the RN. Rationale. LPNs appropriately care for stable clients with predictable outcomes. Newly admitted, unstable, or immediate postoperative clients require RN management. Question 14. An RN delegates ambulation of a stable client recovering from pneumonia to the UAP. While walking, the client suddenly complains of dizziness and shortness of breath. What should the UAP do first? A. Encourage the client to continue walking. B. Assist the client safely to a chair or bed and immediately notify the RN. C. Give supplemental oxygen independently. D. Leave the client briefly to locate the RN. Answer. B. Assist the client safely to a chair or bed and immediately notify the RN. Rationale. UAPs should ensure client safety and promptly report abnormal findings. Assessment and clinical intervention remain the RN's responsibility. Question 15. An RN is preparing assignments for the day. Which task should the RN not delegate to the LPN? A. Administer routine oral medications to stable clients. B. Reinforce dietary teaching initiated by the RN. C. Perform the initial assessment of a newly admitted client with sepsis. D. Change a sterile postoperative dressing according to provider orders. Answer. C. Perform the initial assessment of a newly admitted client with sepsis. Rationale. Initial assessments and care of unstable clients require the RN. Stable medication administration, reinforcement of teaching, and routine treatments are appropriate for the LPN. Question 16. A client with heart failure has been stable for 3 days and requires daily weights. Which assignment is most appropriate for the UAP? A. Determine whether the client's diuretic dosage should be adjusted. B. Obtain the client's weight at the same time each morning and report significant changes. C. Teach the client why daily weights are important. D. Assess for worsening pulmonary edema. Answer. B. Obtain the client's weight at the same time each morning and report significant changes. Rationale. Routine measurements are appropriate for UAPs. Interpretation, teaching, and clinical decision-making are RN responsibilities. Question 17. An RN delegates urinary catheter removal to an experienced LPN for a stable postoperative client. 2 hours later, the LPN reports that the client has not voided and is experiencing lower abdominal discomfort. Which action should the RN take? A. Personally assess the client for urinary retention and determine the next intervention. B. Ask the UAP to insert another urinary catheter. C. Tell the LPN to ignore the complaint until the next shift. D. Instruct the client to drink less fluid. Answer. A. Personally assess the client for urinary retention and determine the next intervention. Rationale. Although catheter removal may be delegated, evaluation of potential complications requires RN assessment and clinical judgment. Question 18. The RN is caring for 4 clients. Which client should remain under the RN's direct care rather than be assigned to the LPN? A. A client receiving routine oral antibiotics for a urinary tract infection. B. A client requiring reinforcement of discharge instructions. C. A client admitted 30 minutes ago with altered mental status of unknown cause. D. A client with a healed surgical incision requiring staple removal. Answer. C. A client admitted 30 minutes ago with altered mental status of unknown cause. Rationale. Newly admitted clients with unstable or undiagnosed conditions require comprehensive RN assessment and ongoing evaluation. Question 19. An RN asks the UAP to obtain intake and output measurements for several clients. At the end of the shift, the UAP reports that one client's urine output was only 120 milliliters over 8 hours. What should the RN do first? A. Assess the client and evaluate possible causes of decreased urine output. B. Tell the UAP to encourage more fluids without further evaluation. C. Document the urine output without assessment. D. Repeat intake and output measurements the next day. Answer. A. Assess the client and evaluate possible causes of decreased urine output. Rationale. UAPs collect data, but interpretation of abnormal findings and subsequent interventions require RN assessment. Question 20. An RN is evaluating delegation practices on the unit. Which statement by a newly hired RN indicates the best understanding of safe delegation? A. Once I delegate a task, I'm no longer responsible for the outcome. B. I can delegate any task if the UAP has experience performing it. C. I remain accountable for ensuring the delegated task is appropriate, completed safely, and properly evaluated. D. Delegation means transferring full nursing responsibility to another team member. Answer. C. I remain accountable for ensuring the delegated task is appropriate, completed safely, and properly evaluated. Rationale. The RN retains accountability for delegated care. Safe delegation requires selecting the appropriate task, person, circumstance, communication, supervision, and evaluation according to the 5 rights of delegation. Question 21. An RN is leading a team consisting of 1 LPN and 1 UAP on a busy medical surgical unit. 4 clients require attention at the beginning of the shift. A 64-year-old admitted 15 minutes ago with acute gastrointestinal bleeding and hypotension. A 70-year-old with chronic obstructive pulmonary disease, COPD, whose oxygen saturation has remained stable on 2 liters per minute via nasal cannula and requires scheduled oral medications. A 56-year-old postoperative client on day 3 after total knee replacement who requires assistance ambulating in the hallway. A 48-year-old newly diagnosed with heart failure who is anxious about discharge and needs education on sodium restriction and daily weight monitoring. Which delegation plan is most appropriate? A. Assign the LPN to admit the client with GI bleeding while the RN teaches the heart failure client. B. Assign the UAP to ambulate the postoperative client while the RN admits the unstable client and later teaches the heart failure client. C. Assign the UAP to teach sodium restriction while the RN ambulate the postoperative client. D. Assign the LPN to complete the discharge education while the RN administers oral medications. Answer. B. Assign the UAP to ambulate the postoperative client while the RN admits the unstable client and later teaches the heart failure client. Rationale. Stable clients needing assistance with ambulation are appropriate for UAPs. Initial assessments of unstable clients and comprehensive discharge teaching are RN responsibilities. Question 22. An RN delegates routine postoperative vital signs to a UAP for a client who underwent abdominal surgery yesterday. The UAP reports a temperature of 39.2 degrees Celsius, 102.6 degrees Fahrenheit, heart rate of 122 beats/min, and increasing confusion. Which action should the RN take first? A. Ask the UAP to repeat the vital signs in 1 hour. B. Immediately assess the client for possible postoperative complications. C. Tell the LPN to administer acetaminophen before assessment. D. Document the findings and continue rounds. Answer. B. Immediately assess the client for possible postoperative complications. Rationale. The UAP appropriately collected data. Interpretation of abnormal findings and clinical intervention require RN assessment. Question 23. Which task is most appropriate to delegate to the LPN? A. Perform the admission assessment on a client with diabetic ketoacidosis. B. Administer scheduled subcutaneous insulin to a stable diabetic client according to provider orders. C. Teach a newly diagnosed diabetic client how to self-administer insulin. D. Develop the nursing care plan for a client with uncontrolled diabetes. Answer. B. Administer scheduled subcutaneous insulin to a stable diabetic client according to provider orders. Rationale. Medication administration for stable clients is generally within the LPN's scope. Initial assessment, patient teaching, and nursing care planning remain RN responsibilities. Question 24. The RN asks the UAP to assist a stable client with breakfast. Shortly afterward, the UAP reports the client suddenly has facial drooping and slurred speech. What should the RN do first? A. Tell the UAP to finish feeding the client. B. Assess the client immediately and activate the stroke response process. C. Wait for the provider before assessing the client. D. Ask the LPN to document the event. Answer. B. Assess the client immediately and activate the stroke response process. Rationale. Sudden neurological deficits require immediate RN assessment and rapid intervention for a possible stroke. Question 25. An RN is assigning clients to an LPN. Which client is the best assignment? A. A client 30 minutes after receiving tissue plasminogen activator, TPA, for an ischemic stroke. B. A stable client requiring routine colostomy care following surgery 1 week ago. C. A client with newly diagnosed sepsis receiving aggressive fluid resuscitation. D. A client admitted with status epilepticus. Answer. B. A stable client requiring routine colostomy care following surgery 1 week ago. Rationale. Stable clients with predictable needs are appropriate assignments for the LPN. High acuity and newly admitted clients require RN management. Question 26. Which activity may the RN appropriately delegate to the UAP? A. Evaluate the effectiveness of pain medication after administration. B. Collect a routine stool specimen from a stable client. C. Perform neurological checks every hour after head injury. D. Assess breath sounds in a client with pneumonia. Answer. B. Collect a routine stool specimen from a stable client. Rationale. Specimen collection is within the UAP's role. Assessment and evaluation remain RN responsibilities. Question 27. An RN delegates sterile dressing changes to an experienced LPN for several stable clients. During one dressing change, the LPN reports purulent drainage, increasing redness, and wound separation. What should the RN do first? A. Personally assess the wound and determine the need for further intervention. B. Ask the UAP to photograph the wound. C. Tell the LPN to ignore the changes until rounds. D. Document the drainage without assessment. Answer. A. Personally assess the wound and determine the need for further intervention. Rationale: the LPN correctly recognized abnormal findings. Evaluation and clinical decision-making require the RN. Question 28. The RN is supervising a UAP caring for a stable client with dementia. Which task should not be delegated to the UAP? A. Assist with bathing. B. Feed the client after swallowing ability has been assessed. C. Assess whether the client's confusion has worsened compared with yesterday. D. Measure and record intake and output. Answer: C. Assess whether the client's confusion has worsened compared with yesterday. Rationale: comparing neurological status requires nursing assessment. ADLs and routine measurements may be delegated. Question 29. The RN is assigning responsibilities during a busy shift. Which task should the RN perform personally? A. Obtain routine daily weights. B. Assess a client who reports sudden crushing chest pain. C. Assist a stable client with toileting. D. Transport a stable client to radiology. Answer: B. Assess a client who reports sudden crushing chest pain. Rationale: acute chest pain is a potentially life-threatening change in condition requiring immediate RN assessment and intervention. Question 30. A newly licensed RN asks an experienced charge nurse how to determine whether a task can be delegated. Which response by the charge nurse is most accurate? A. Delegate any task you don't have time to complete. B. Delegate only after considering the 5 rights of delegation: the right task, circumstance, person, direction/communication, and supervision/evaluation. C. Only physicians determine whether delegation is appropriate. D. Experienced UAPs can independently perform any nursing task if they have done it before. Answer: B. Delegate only after considering the 5 rights of delegation: the right task, circumstance, person, direction/communication, and supervision/evaluation. Rationale: safe delegation follows the Nclex 5 rights of delegation. The RN remains accountable for delegated care and must ensure the task, patient, and team member are appropriate. Question 31. An RN is coordinating care with 1 LPN and 1 UAP on a busy medical surgical unit. For clients require attention simultaneously. A 68-year-old admitted 20 minutes ago with suspected septic shock who is hypotensive despite receiving 4 fluids. A 72-year-old with chronic kidney disease who is stable and requires a scheduled sterile dressing change to an arteriovenous fistula site. A 55-year-old recovering from a total knee replacement who needs assistance ambulating to the bathroom. A 63-year-old newly diagnosed with atrial fibrillation who requires education before starting a apixaban therapy. Which assignment demonstrates the best use of delegation? A. Ask the LPN to perform the admission assessment for the septic shock client, while the RN teaches the atrial fibrillation client. B. Assign the UAP to ambulate the postoperative client, the LPN to perform the sterile dressing change, and the RN to manage the septic shock client and provide anticoagulant education. C. Ask the UAP to reinforce anticoagulant teaching while the RN assists with ambulation. D. Assign the LPN to independently evaluate the septic shock client's response to 4 fluid resuscitation. Answer: B. Assign the UAP to ambulate the postoperative client, the LPN to perform the sterile dressing change, and the RN to manage the septic shock client and provide anticoagulant education. Rationale: stable, predictable tasks such as ambulation are appropriate for the UAP, while routine sterile dressing changes for stable clients may be assigned to the LPN. The RN must care for unstable clients and perform initial teaching. Question 32. The RN delegates routine blood glucose monitoring before lunch to a UAP for a client receiving insulin therapy. The UAP reports a glucose level of 392 milligrams per deciliter, 21.8 millimoles per liter, and states the client appears unusually sleepy and is breathing rapidly. What should the RN do first? A. Ask the UAP to repeat the blood glucose after lunch. B. Assess the client immediately for possible diabetic ketoacidosis or hyperosmolar hyperglycemic state. C. Tell the LPN to administer additional insulin without assessment. D. Document the abnormal glucose level before seeing the client. Answer: B. Assess the client immediately for possible diabetic ketoacidosis or hyperosmolar hyperglycemic state. Rationale: collecting glucose readings is appropriate for the UAP. Interpretation of abnormal findings and initiation of treatment require immediate RN assessment. Question 33. Which client is most appropriate for assignment to the LPN? A. A client newly admitted with acute pancreatitis experiencing severe abdominal pain. B. A stable client with a healing pressure injury requiring a scheduled dressing change and routine oral medications. C. A client returning from the operating room 15 minutes ago after bowel surgery. D. A client with sudden onset of confusion and unequal pupils. Answer: B. A stable client with a healing pressure injury requiring a scheduled dressing change and routine oral medications. Rationale: LPNs are appropriate caregivers for stable clients with predictable care needs. Newly admitted, immediate postoperative, or neurologically unstable clients require RN management. Question 34. The RN delegates morning hygiene to a UAP for a stable client recovering from pneumonia. While providing care, the UAP reports the client suddenly becomes extremely short of breath, with blue lips and difficulty speaking. What should the RN do first? A. Tell the UAP to complete the bath. B. Immediately assess the client and initiate emergency interventions. C. Wait for respiratory therapy before evaluating the client. D. Ask the LPN to finish the bath. Answer: B. Immediately assess the client and initiate emergency interventions. Rationale: a sudden change in respiratory status requires immediate RN assessment and intervention. The UAP appropriately recognized and reported the abnormal finding. Question 35. Which task should never be delegated to the UAP in a standard NCLEX scenario? A. Measuring daily weight. B. Recording intake and output. C. Assessing whether a postoperative client's pain medication was effective. D. Assisting a stable client with feeding after a swallowing assessment has been completed. Answer: C. Assessing whether a postoperative client's pain medication was effective. Rationale: evaluation of treatment effectiveness is an RN responsibility. UAPs may assist with routine, non-assessment tasks. Question 36. An RN is supervising an LPN caring for a client receiving intravenous antibiotics. During medication administration, the LPN reports the client suddenly develops hives, wheezing, and facial swelling. What should the RN do first? A. Personally assess the client and initiate emergency management for anaphylaxis. B. Tell the LPN to continue the antibiotic. C. Ask the UAP to obtain routine vital signs before assessment. D. Document the allergic reaction after the medication is complete. Answer: A. Personally assess the client and initiate emergency management for anaphylaxis. Rationale: the LPN correctly recognized the complication. The RN must rapidly assess, stop the offending medication, and initiate emergency interventions. Question 37. The RN asks the UAP to obtain orthostatic vital signs on a stable older adult. The UAP reports that the client became dizzy upon standing. Which RN action is most appropriate? A. Personally assess the client for orthostatic hypotension and implement fall precautions. B. Tell the UAP to repeat the procedure immediately. C. Document the dizziness without further evaluation. D. Encourage the client to walk independently. Answer: A. Personally assess the client for orthostatic hypotension and implement fall precautions. Rationale: UAPs may obtain orthostatic vital signs, but abnormal findings require RN assessment and intervention. Question 38. Which statement by an LPN indicates a need for additional education regarding delegation? A. I can reinforce teaching that the RN has already provided. B. I can care for clients whose conditions are stable and predictable. C. I can independently perform admission assessments for unstable clients if I have experience. D. I should immediately notify the RN if my client's condition changes unexpectedly. Answer: C. I can independently perform admission assessments for unstable clients if I have experience. Rationale: initial assessments of unstable or newly admitted clients require the RN regardless of the LPN's experience. Question 39. The RN delegates routine vital signs to a UAP for 4 stable clients, which reported finding requires the RN's immediate assessment. A. Blood pressure 128/78 mmHg in a client with hypertension. B. Temperature 37.1 degrees Celsius 98.8 degrees Fahrenheit after acetaminophen administration. C. Oxygen saturation of 84% on a client previously maintaining 96% on room air. D. Heart rate 76 beats/min after morning medications. Answer: C. Oxygen saturation of 84% on a client previously maintaining 96% on room air. Rationale: a sudden drop in oxygen saturation indicates acute respiratory compromise and requires immediate RN assessment. Question 40. A newly licensed RN asks the charge nurse which principle best summarizes safe delegation. Which response is most accurate? A. Delegation transfers accountability to the person receiving the task. B. The RN is accountable for delegated care and must supervise, evaluate outcomes, and intervene when necessary. C. Only routine medication administration should ever be delegated. D. If a UAP has years of experience, RN supervision is unnecessary. Answer: B. The RN is accountable for delegated care and must supervise, evaluate outcomes, and intervene when necessary. Rationale: accountability always remains with the RN. Safe delegation requires ongoing supervision, evaluation, and appropriate intervention whenever client conditions change. Question 41. An RN is supervising an LPN and a UAP during a hectic morning shift. For clients require care. A 60-year-old admitted 30 minutes ago with an acute ischemic stroke awaiting thrombolytic evaluation. A 67-year-old with chronic venous insufficiency who requires a scheduled compression dressing change. A 58-year-old who is 3 days postoperative following a hip replacement and needs assistance walking in the hallway. A 73-year-old with newly diagnosed chronic kidney disease who requires education about dietary potassium restrictions before discharge. Which delegation plan is most appropriate? A. Assign the LPN to perform the initial neurological assessment of the stroke client. B. Assign the UAP to ambulate the postoperative client, the LPN to perform the compression dressing change, and the RN to manage the stroke client and provide discharge teaching. C. Ask the UAP to provide dietary education because printed teaching materials are available. D. Assign the LPN to independently determine the stroke client's eligibility for thrombolytic therapy. Answer: B. Assign the UAP to ambulate the postoperative client, the LPN to perform the compression dressing change, and the RN to manage the stroke client and provide discharge teaching. Rationale: the RN must perform initial assessments, manage unstable clients, and provide initial teaching. The LPN may care for stable clients with predictable needs, and the UAP may assist with ambulation. Question 42. An RN delegates routine postoperative vital signs to a UAP. The UAP reports that a client who underwent bowel surgery yesterday has a respiratory rate of 30 breaths/min, oxygen saturation of 86%, and increasing restlessness. What should the RN do first? A. Personally assess the client and initiate interventions for possible respiratory compromise. B. Ask the UAP to repeat the vital signs after lunch. C. Tell the LPN to document the findings. D. Continue medication administration before assessing the client. Answer: A. Personally assess the client and initiate interventions for possible respiratory compromise. Rationale: the UAP appropriately collected the data. The RN must immediately evaluate and intervene when abnormal findings indicate possible deterioration. Question 43. The RN is assigning clients to an experienced LPN. Which client is most appropriate? A. A stable client requiring routine tracheostomy care that has been performed daily without complications. B. A client admitted 15 minutes ago with severe chest pain. C. A client who returned from the PACU 20 minutes ago. D. A client with newly diagnosed diabetic ketoacidosis receiving an insulin infusion. Answer: A. A stable client requiring routine tracheostomy care that has been performed daily without complications. Rationale: Stable clients with predictable care needs are appropriate assignments for the LPN. Newly admitted, immediate postoperative, and critically ill clients require RN management. Question 44. The RN asks a UAP to obtain morning weights for several clients with heart failure. The UAP reports one client gained 3 kilograms, 6.6 pounds, since yesterday and has swollen ankles. What should the RN do first? A. Assess the client for worsening fluid overload. B. Tell the UAP to weigh the client again tomorrow. C. Document the finding without further action. D. Ask the UAP to increase the client's fluid intake. Answer. A. Assess the client for worsening fluid overload. Rationale. The UAP appropriately obtained the weight. The RN must interpret significant changes and assess for heart failure exacerbation. Question 45. Which task should not be delegated to the LPN? A. Reinforce ostomy care previously taught by the RN. B. Administer routine oral medications to a stable client. C. Perform the initial nursing assessment of a client admitted with meningitis. D. Change a sterile dressing for a stable postoperative client. Answer. C. Perform the initial nursing assessment of a client admitted with meningitis. Rationale. Initial assessments of newly admitted or unstable clients require RN clinical judgment. Question 46. An RN delegates feeding assistance to a UAP for a stable client with Parkinson's disease whose swallowing ability was previously evaluated. During lunch, the UAP reports persistent coughing and a wet, gurgling voice. What is the RN's priority action? A. Immediately assess the client, stop oral intake, and evaluate for aspiration. B. Encourage the UAP to continue feeding slowly. C. Document the coughing after the meal. D. Wait until the provider makes rounds. Answer. A. Immediately assess the client, stop oral intake, and evaluate for aspiration. Rationale. The UAP correctly recognized a possible complication. The RN must immediately assess and intervene to prevent aspiration. Question 47. The RN delegates routine blood glucose monitoring to the UAP. One client has a glucose level of 42 milligrams per deciliter, 2.3 millimoles per liter, and is difficult to awaken. Which action is the RN's priority? A. Personally assess the client and initiate the hypoglycemia protocol immediately. B. Ask the UAP to repeat the blood glucose in 1 hour. C. Tell the LPN to document the result. D. Continue caring for other clients before evaluating the finding. Answer. A. Personally assess the client and initiate the hypoglycemia protocol immediately. Rationale. Severe hypoglycemia is a medical emergency requiring immediate RN assessment and treatment. Question 48. A newly hired RN says, since my LPN has worked here for 20 years, I can let her independently evaluate unstable clients. Which response by the charge nurse is most appropriate? A. Experience changes the legal scope of practice. B. Experience is valuable, but the RN remains responsible for assessment, evaluation, and care of unstable clients. C. Only physicians are responsible for unstable clients. D. LPNs may independently perform any assessment after orientation. Answer. B. Experience is valuable, but the RN remains responsible for assessment, evaluation, and care of unstable clients. Rationale. Experience does not expand the legal scope of practice. Initial assessment, evaluation, and management of unstable clients remain RN responsibilities. Question 49. The RN is reviewing delegation principles with a group of new nurses. Which task is most appropriate to delegate to the UAP? A. Assess the effectiveness of oxygen therapy. B. Teach postoperative deep breathing exercises. C. Assist a stable client with toileting and record urine output. D. Decide whether a client's pain medication should be repeated. Answer. C. Assist a stable client with toileting and record urine output. Rationale. UAPs may assist with ADLs and collect routine data. Assessment, teaching, and clinical decision-making are RN responsibilities. Question 50. At the end of the shift, the charge nurse asks a newly licensed RN to summarize the safest delegation principle for the Nclex. Which statement demonstrates the best understanding? A. I delegate tasks based only on how busy I am. B. Stable, predictable tasks may be delegated, but I retain accountability, supervise delegated care, and immediately assess any unexpected change in a client's condition. C. Once the LPN accepts an assignment, the RN is no longer responsible for the outcome of that client's care. D. Experienced UAPs may independently perform assessments if they have demonstrated competency on the unit. Answer: B. Stable, predictable tasks may be delegated, but I retain accountability, supervise delegated care, and immediately assess any unexpected change in a client's condition. Rationale: this statement accurately reflects the NCLEX 5 rights of delegation. The RN may delegate appropriate tasks to qualified team members, but retains accountability for the nursing care provided. The RN must ensure the task is appropriate, provide clear instructions, supervise performance, evaluate outcomes, and personally assess clients whose conditions become unstable or require clinical judgment. Neither experience nor workload changes the legal scope of practice for the LPN or UAP. Great work completing all 50 questions. Delegation is one of the highest yield topics on the NCLEX because it directly reflects safe, effective nursing practice. Remember these key principles. The RN assesses, teaches, evaluates, and manages unstable clients. The LPN cares for stable clients with predictable outcomes and reinforces teaching. The UAP assists with routine, non-invasive tasks and activities of daily living, but does not assess, teach, or evaluate. Review any questions you missed, study the rationales carefully, and keep practicing until these delegation rules become second nature. If you found this practice set helpful, be sure to like, subscribe, and share it with classmates preparing for the NCLEX. Thanks for watching, and I'll see you in the next practice session.